What have you seen about onset in the textbooks that you're reading?
Usually says 30, 45 seconds for onset of propofol from my reading. Do you teach differently?
No, I think that's 100% correct. If you're giving a traditional induction dose, right, you're giving like the full dose and the weights per kilogram for the patient. But it's that kind of shocked me when I hit the OR because as an ICU nurse, you're just starting a drip and it feels like it takes forever to quote unquote set up. The reason why that happens is because of distribution. And distribution is something you'll have to learn when you study pharmacokinetics if you haven't gotten there yet. But when we give an IV medication in a big bolus, it behaves differently in the body than when you start an infusion slowly. So when we first give the medication, it's going to rapidly distribute out into the periphery. It crosses the blood-brain barrier and affects the central nervous system very quickly. And then it kind of gets like slowly redistributed to like our organs, and our fat takes it up, and our blood concentrations and the amount of free propofol available drops really fast. So after a one-time dose of propofol, it has a pretty short duration of action. It goes away in about 5 minutes. I think you can read in the textbooks like 5 to 8 minutes or something like that. And that's true clinically. That's what we see in real life all the time. Again, that was really different than when I was an ICU nurse and my patients would be on propofol for 3 days and then we'd turn it off and we'd wait for hours for them to wake up. So that's because it's slowly accumulating in the tissues and building up stores. And then once you turn off the drug, you're no longer infusing it into the bloodstream. You have a new concentration gradient, right? It's going to slowly leach back out of the fats and out of the muscles and out of the organ beds and go into the bloodstream and continue to have its effects until it's completely metabolized and cleared.